How long does it take for GLP-1 medications to start working? Initial effects on blood sugar may appear within 1 to 2 weeks, and appetite suppression within days to weeks, but full therapeutic response typically requires 12 to 20 weeks with gradual dose increases. If you've just started a GLP-1 medication, you're probably wondering when you'll actually start feeling different. The answer isn't as simple as a single number because these medications work on multiple systems in your body and each one has its own timeline. Let's start with what GLP-1 medications actually do. Most of these are injectable medications, though there is one oral option available. They mimic hormones your body naturally produces after you eat, working in several places at once. In your pancreas, they help release insulin when your blood sugar is high, but only when it's high, which means less risk of your blood sugar dropping too low compared to some other diabetes medications. So they also suppress a hormone called glucagon that raises blood sugar. Beyond that, they slow down how quickly food leaves your stomach initially, and they work on appetite centers in your brain to reduce hunger signals. Now, here's where timing gets interesting. Different effects kick in at different speeds. Research suggests that blood sugar effects often start appearing within 1 to 2 weeks of beginning treatment. Some people notice appetite suppression even sooner, within days to weeks, though this varies quite a bit from person to person. But here's the important part. Reaching the full therapeutic response typically takes 12 to 20 weeks. That's 3 to 5 months. Why so long? It comes down to how these medications are prescribed. You don't start at the full dose right away. Instead, your healthcare provider will gradually increase your dose over several months. This gradual escalation serves two purposes. First, it helps minimize gastrointestinal side effects, like nausea, which are the most common side effects people experience. Second, it allows your body to adjust as you work up to the optimal therapeutic dose. The specific timeline also depends on which medication you're taking. Weekly formulations like semaglutide take 4 to 5 weeks just to reach what's called steady-state drug levels, meaning the amount in your system stays consistent. Daily medications like liraglutide reach steady state much faster in 2 to 3 days, but even after reaching steady state, you're still gradually increasing doses according to your prescribed schedule. Several factors can influence how quickly you notice effects. Your starting blood sugar levels matter. If they're significantly elevated, you might notice improvement sooner. Your individual metabolism, how well you tolerate dose increases, and whether you're taking other medications can all play a role. Adherence is crucial too. Missing doses or not following the prescribed schedule can delay your response. It's also worth understanding that some effects might diminish over time. For example, the slowing of gastric emptying that happens initially may become less pronounced with long-acting formulations as your body adapts, though other mechanisms continue working. So what should you discuss with your healthcare provider? First, make sure you understand your specific titration schedule. Know when your dose will increase and what to expect at each stage. Ask about realistic timelines for your particular situation and treatment goals. If you're experiencing side effects that make it hard to continue, talk to your doctor before stopping. There may be strategies to manage them. And remember, never adjust your dose without your healthcare provider's guidance. Now let's talk about safety and when to reach out to your doctor. These medications carry a boxed warning for thyroid C-cell tumors. They're not appropriate for everyone, particularly if you have a personal or family history of medullary thyroid carcinoma or a condition called MEN2. Contact your healthcare provider if you experience severe, persistent nausea that won't go away, severe abdominal pain, repeated episodes of low blood sugar, or if you're not seeing any response after 12 to 16 weeks at your maintenance dose. These could signal that adjustments are needed or that this medication isn't the right fit for you. Here's what to remember. Initial effects on blood sugar typically appear within 1 to 2 weeks, with appetite changes possibly happening even sooner. But full therapeutic response takes 12 to 20 weeks as your dose gradually increases. Different medications have different timelines for reaching steady levels in your system, and factors like your individual metabolism, adherence to your prescribed schedule, and tolerance of dose increases all influence your personal timeline. This is a marathon, not a sprint. Setting realistic expectations from the start helps you stay committed to the process. Always consult with your healthcare provider about your specific situation. They can give you personalized guidance based on your medical history and treatment goals. What's been your experience with starting a GLP-1 medication? Drop a comment below. And if you found this helpful, Hit that like button and subscribe for more evidence-based health information from Fella Health.